Is allowing CPS to run roughshod over parental authority. Our children are our responsibility, not yours. We will not allow our children to be part of your schemes.
My daughter, who's 2, came down with a gastrointestinal bug, one of those really nasty stomach bugs that usually lasts about 24 hours, and you're puking and everything, and it's just your fever. It's terrible. Then you finally the fever breaks, and you're good. Like after about 20. Yeah. So it was one of those bugs, but she never gotten sick like that before. It's the first time she actually had been sick in the 2 years of her life. So when we picked her up from my cousin who was babysitting her at the time. As soon as we put her in the car, she threw up, and there was some blood present in the vomit. So of course, parents, we panicked. She's getting lethargic. We're like, oh my God, freaked out. So we rushed her to urgent care across the street over there, actually, and she threw up there. And then they say, okay, well, you need to go to the emergency room across the street. So we take her over here. They suggested that they keep her overnight because she's very lethargic, and and I talked to my sister is a nurse, an RN. Her husband's a nurse practitioner, so of course I was talking to her, and she's like, yeah, this happened to Maddox, my nephew, and when he was like 4 years old, and they had to keep him overnight and give him fluids. So we're very compliant at that point. We're like, okay, we can spend the night here and let them put fluids on her. So we spent the night in the hospital with her in an IV all night. They wanted to wait 48 hours for this bacteria culture test to come in. They want to test her for Hep A, all this stuff. My daughter is not vaccinated, so that made them think that they needed to run a lot more tests, be a lot more thorough. So we, of course, thought we'd be sent home the next day.
Yeah.
Didn't turn out that way. They ended up keeping us there a second night. The next day, the main head pediatric doctor comes in, and she says, okay, well, we're going to pull her off the IV today and stop with the Tylenol because and then she explains to me what we already know about the immune response. Like, she needs to have this fever. She needs an opportunity to drink for herself. And we're like, this is day 3 now, and you guys are just figuring this out.
Okay.
So, of course, as soon as they pull her off that stuff, about 11 o'clock in the morning, she takes like a 3-hour nap. She finally sleeps, so she's just out. She wakes up very clearly, like, refreshed. I mean, she was still ill, but it was clearly like she had broken whatever had happened. She had broken the fever. Yeah. She was drinking water. She started eating. Okay. We're like, sweet, okay,
let's go home.
Yeah. Exactly. So we go out to the nurse that's out in the kind of lobby area in the pediatric department. We're like, well, we decided that we want to take our daughter home.
Okay.
Now, and the first thing out of her mouth is, well, if you decide to do that, we're going to have to call Child Protective Services. My wife's like hysterical at this point, freaking out. So I go and talk to her myself. I knock on her office door, and I'm like, so we talked it over, and we decided that we're going to go ahead and leave and take her daughter out here. And if you have to call CPS, that's fine. We know we're good parents. We've got nothing to hide. We just think it would be better for our daughter if we got her out of here. And so then at that point, she proceeded to use the mafia tactics of, that's a really nice family you have. It'd be a shame if something happened to it, kind of a thing. Wow. Because she talks about, then she's like, I just want to send you home clean. And why even get CPS involved? Like, no one wants to get them involved. Like, the total thing, right? And she also she even told me at this time that had my daughter was current on all her vaccinations, we would have been in and out of there. So then she basically admits to us that because she wasn't vaccinated, that's the reason we're having to stay this prolonged period of time. By this time, it was on the 3rd day. It was already like 5:30, 6 in the afternoon and evening. I'm like, you know what? As long as you're not going to do any more tests on my daughter, we're going to leave her alone. Fine, we'll stay this extra day. Don't.
A 4th day.
The 3rd night. This would be the 3rd night.
This would be the 3rd night.
The 3rd night.
Then you're going into the 4th day.
Yeah. So the next morning they did discharge us with another doctor. It was like the 3rd doctor we saw. So she discharges us. We think everything's fine. We sign her things and we leave. Prior, like the 2nd day, they told us that. They wanted us to do a follow-up pediatric appointment because she didn't have a lot of those, because we don't believe in taking our daughter or even going to you don't go to the doctor when you're not sick.
Especially after you hear about things like this.
Yeah, our daughter's traumatized. We weren't going to take her back. She was healthy. So that was something that they had scheduled for us on Monday, and we canceled. Wednesday the next week, CPS shows up with 2 police officers to our house.
So what reason did Kootenai give for calling CPS, since he did comply according to, even though you don't have to?
Well, what we found out was, because I went and got her medical charts, I got her medical records here. In the medical chart, in the records, we were uninformed of this, but they had written down in there that if we did not go to that follow-up appointment within 48 hours of her being released, that was the contingency of them releasing us, that they were going to call Child Protective Services.
They did not inform you?
No, we were not told that. We would have went. We would we would have complied. The reason police officers showed up to our house is because when Kootenai made the call, they said that we were combative. And so what happens is...
combative in any way?
Of course not. No, look at me. I'm a video nerd. I'm a nerd. I'm a total dork. I play Magic the Gathering. So, so it turns out when they send in a call to Child Protective Services, and then the Child Protective Services sends the call out to police, it's based on a threat rating. There's a threat rating that they use.
Okay.
So they sent us in as the highest threat. Otherwise, it would have just been a caseworker showing up at our door. The statistics is something like 83% of all calls to CPS are unsubstantiated. So the vast majority are unsubstantiated, and it's all just based on bogus policy stuff where they, and of course, the one thing that really bothered me, probably the one thing that sticks out to me most that the doctor said when she coerced us to stay that final night, was she said the reason we have to call CPS if you leave against medical advice is because the children can't speak for themselves. And all I'm thinking in the back of my head is, well, there's only two people on this earth who have the legal authority to speak for my child, and that's me and my wife.
Absolutely.
And we're telling you we want to leave.
It's clear government overreach and private hospital overreach.
Oh yeah.
I mean, this is absolutely
It's a racket.
astonishing.
It's a racket because it's a sweetheart deal between the hospital and CPS, because CPS, they get their funding based on how many children they pull from homes and put in foster care. That is literally how they get paid.
Right.
You know, if they don't pull enough kids out, they lose funding. They lose budget money every year. And then Kootenai, well, they get to use that coercive threat of the state against parents to keep children there longer so they can make more money. So it's like a little awesome little, it's like a racket that kind of got going on.
It's unbelievable.
So I had surgery about 3 weeks ago, and I had complications. Came into the hospital hemorrhaging. It was there for 5 hours before they finally did surgery. But I walked in and said, I need you to call my surgeon. I'm having this issue. The problem really happened when the nurse did her intake, and she asked, have you ever had thoughts of harming yourself or others? And I said, well, you know, because they want to make sure, I mean, it's kind of, do you have any weapons? She has a lot of questions. And so I said, I was crying. I was so frustrated. It's been a month long of these complications.
Sure.
And I wasn't suicidal by any means. I guess I was
Right.
just trying to be
You're
forthcoming with, I don't think I'm so great emotionally right now. I'm having a hard time. And my husband was with me, and he said, yeah, she's had a really hard month. It's been hard. And so she said, well, because you said that, we want to ask you more questions and make sure that you're okay. And I said, that's okay, because I want you to keep safe, and I'm okay, but I get that that's part of your intake. And so the doctor came in and asked a lot of good questions and personal questions of my husband and I, and at the end he said, you know, it sounds like you're having a hard time, but you're obviously not suicidal, you're safe. He's like, so I'm fine to clear you, we're going to get you some medical care, and that sounds great. The next thing I knew, a psychiatrist was coming in. They had security came in. Security, I'm naked on a gurney, bleeding, and security is wanding me. Didn't say who they were, what they were doing. And a new doctor came in, and a psychiatrist came in. When the psychiatrist came in, she said, "Can I ask you some questions?" And I said, "Okay." And again, I'm on the bed in pain, bleeding, waiting for my surgeon to show up. She started to ask the same questions that the doctor asked. And so after 2 questions, I stopped her and I said, not to interrupt, but is this something that I can opt out of? And she
Right.
said, what do you mean? And I said, well, can I decline to have this conversation? I'm in pain, I'm a little distracted, I understand what you're doing, but the doctor already cleared me, everything's fine. Can I decline to have, because I don't want to have this conversation anymore, I want to talk about how you're going to stop my bleeding.
Which is your right.
And
Yeah.
she said, yeah. She said, sure. And I said, okay, great. 2 minutes later, a new doctor walked in. And he said, we heard that you're declining speaking with psych, and that's a big red flag for us. And I said, well, I didn't decline. I asked if I had a right to not partake, and she said yes. And the doctor already cleared me. And he said, well, I'm a new doctor, and that's not the message I got. And he said, so we want you to know if you decline, we're going to put you on a 24-hour psych hold. She'll come back tomorrow. If you don't talk to her then, we'll put you on another hold. And he
Wow.
said, we'll put you on indefinite psych holds until you're willing to speak. I said to him, I'm fine with you asking these questions, but I need you to, at the same time, provide medical care. I was very clear. I feel like you are withholding medical care from me right now
So
to
they
address an
haven't
issue that is
treated
not
you
an issue. They
at
had
this
they had packed me with medicines to see if they could stop the bleeding, but it had not. It was still hemorrhaging. The one doctor had treated me with that, but then he left. The second doctor had been there an hour, and he still hadn't examined me.
Right.
And I have so much blood that it's dripping on the floor. I'm being denied treatment right now. By the time the doctor said, I said, I want you to examine me right now. And he said, it's going to be very painful. I want to get you payments. And I said, I want you to examine me now. I need to be treated now.
Right.
He finally checked me and he went into panic mode. He saw what was happening. He realized how much blood was on the
After
gurney.
how many hours?
We'd been at the hospital 4 hours.
Before they finally realized that
Before they
that
understood
this is serious
that it was
and you
still
need help.
continuing. Yeah. They knew it was serious when I came in. It's when he finally realized their treatment had not been working.
Okay.
So he told the nurse, I want you to do pressure on this. Do not move. Do not leave her. Do not let up. This is serious. He ran out into the hall, said, Paige, Dr. So-and-so stat.
Yeah.
And I was in surgery in less than an hour.
Well, it's just frightening. I mean, you almost have to be like a lawyer to speak to medical staff for your
Right.
own protection.
I was trying to be understanding of the I'm a mandated reporter.
Right.
I want to keep babies safe. I understand the initial intention behind all of this. What I don't understand is the infringement upon parents' rights, patients' rights for their own medical care.
And that's something interesting that you have in Idaho. I don't know if we have this in Spokane. I'm from Spokane, Washington. But being a mandated reporter, is every citizen a mandated reporter?
No,
or
a
is it
healthcare provider.
Every healthcare
Provider, teacher, counselor, anyone who is providing care in that way.
Okay, and they're required if you see something that you think could be a
Right.
problem.
So the problem is whether or not someone is at risk is determined by the individual reporter.
Yes.
So for example, if I have a patient who's not vaccinating their kids, I could say, okay, that's your choice. If I was pro-vax and I thought you were endangering your child by not vaccinating, I could turn you in.
Very
You will
frightening.
be investigated.
Yeah.
And the problem with what we're having here at Cooney Health is you have a hospital with many different providers with their own agendas, their own cover themselves, all this going on. There's no consistency in policy. We've said, what is your policy? Our policy is we're mandated reporters. What are the criteria to report? It's based on each individual.
Wow.
Well, then where's the accountability? There is
Yeah.
none. And they're not Kootenai employees, so Kootenai's not going to hold them accountable.
You know, body sovereignty and body autonomy is our ultimate freedom and right. We should be the ones to decide what food we eat, what things we drink, what medications we take, if we take any at all. That is bodily autonomy and bodily sovereignty. And parents have that sovereignty over their children. So they are the ones, their parental rights guarantee that they get to make the decisions for their children. There has been an assault on parental rights and on our children to mandate products that don't have that are liability free and can cause danger. They can cause injury. They can kill people. And you have no legal recourse to sue the manufacturer. And in a free society, there's no place for mandating any kind of consumer product.
That's a great point. You know, I'm a pro-life or an abolitionist, and you hear from the other side, you know, my body, my choice.
Yeah.
Right? Mm-hmm. So it astonishes me. This is something that everybody on every political spectrum should be united on. You know, so it astonishes me that the government can come in and tell you what you have to inject into your body.
Yeah. Well, the one thing about vaccine injury is it doesn't choose race or color or socioeconomic status.
Right.
It doesn't choose whether you're Republican or Democratic. It's going to injure your child, and it doesn't care. The First and the Fourth Amendment are pretty clear that you're not required to be a human being in this society. You're not required to inject a consumer product to be a part of the human society.
If you're not vaccinated, they go through every test that they can to alleviate all the vaccines that they.
When I hear Spinal Tap, that's just shocking to me to do on a child.
Yes.
How do you know how young?
So I just overheard Misty from Health Freedom Idaho saying that they did it 3 times on a 21-day-old baby until the parents said that's enough. So for a mother like me to go to the emergency room is like a very fearful thing to do.
So I did want to tie in the whole vaccine issue and what's happening in California as
Yes,
well, because
yes.
that's breaking news right now. That
Yes,
was made.
yes.
So
They just
tell us
basically
about
took
that.
away medical exemption, so it's no longer between you and your doctor. It's now between you and the government. So they're now taking away all the medical exemptions, and they're putting them into a review board that the government can tell you that you're sick enough to have a medical exemption. It's not your doctor telling you this. And now doctors are put on where they can only give away 5 exemptions before they're then put on a review board themselves. So no doctors are going to write any exemptions. And how can they ethically say like, oh, okay, you get one and you don't?
So
Because they can
5
only give away 4 before they're then sent to the principal's office. What is excused for a medical exemption, anaphylaxis, and they called 882 doctors' offices. And that's the one where you're supposed to get a medical exemption for, and 882 doctors denied them.
And they could lose their medical license
Yes,
potentially?
yes,
Is that-
yes.
So there's coercion, not
Definitely
only to
coercion.
now, they start with the parents, but now
Yes.
they remove that buffer.
Yes.
And now the doctor is the next buffer, and they go
Yes.
after the doctor
Yes.
to where there's no buffer between the government and the child.
Yes.
Is that accurate? Is
Yes.
That, okay.
When doctors want to tell you that they're not getting paid, when they see my child for a well visit, they get $50. When they see a child that's getting vaccines, they get $450. So you times that by their whole patients, and they are getting paid, whether they tell you they're not getting paid or not, but they are. If I could just inspire people to come out and to take to the streets and to start talking to your friends and your family, because this issue is bigger than all of us, and we all need to now organize and to get together.
I don't know if you are aware of baby Elijah that was taken at birth a couple of years ago. It was literally his 2nd day of life, and Dad had refused the hepatitis B vaccine at birth, and he said everything changed. And so that's when CPS got involved, and they're literally saying that there's imminent danger while the baby's in the hospital. Mom had just given birth, so they removed the baby from the parental care. Also on the police report was that the father had continued to allow the baby to sleep on his chest, criminalizing baby sleeping on Dad's chest. There's a lot of money being given to states, federal dollars, these are our Social Security dollars, when children are removed from families, and bonuses given when children are adopted out. 88% of the children recovered from sex trafficking have been from CPS.
That's just horrific.
It's horrific, and that's when I thought, oh my gosh, I have to do everything that I can to protect my babies, right? And I have one that's 19, he's no longer a baby, right? But then it affects his babies, it affects my grandbabies, it affects our community, it affects our state. I mean, if these children are being taken from their families, and families ruined, and children ruined through child sex trafficking, and even if you don't go that far, even if you're just removing children and putting them into another home, they are more likely to be abused.
Right.
They're more likely to suffer in foster care than being home. So why aren't we putting that money and those incentives into keeping families together, healing families, whether it's drug abuse or whatever it is? Let's keep the family together, because statistics show that they're safer with their families. I don't know if you know this, but there's cameras in the patients' rooms.
Oh.
So they literally feel like they're in jail. They literally feel like they're in jail. So even if they want to do something for their child, they know they're being watched at all times. The staff is being watched at all times. And then another parent just reminded me that there's a bracelet, a tracking bracelet on the wrist of the baby, and she said she had one put on her ankle because they were afraid that she was going to leave.
That the mother was going to...
Yes.
Wow.
And I was like, that sounds like prison to me in every way.
So you need to be willing to potentially give up your parental rights and your individual rights by simply visiting
Right.
hospitals like Kootenai Health.
Right.
Okay.
And so you can see the urgency
Wow.
of why this really needs to change. Kootenai Health is in a taxing district, so they have a board where the citizens can actually speak.
Yeah.
And although they make it very hard, so we faxed it to the fax number that we found, and I'm happy to say that they did get it into the right hands, so the board knew that there was an issue and that the citizens were taking issue with what was happening here at Kootenai Health. So they said that they were putting together a task force, that they would put together a Q&A, that they would email out to their staff and also put online. And so they made a lot of, like, here, we're really working on it kind of thing. But then when we saw the Q&A that went out to the staff, you can really see that they are pointing to Idaho's neglect statute and the mandatory reporting law, and saying that they have the right, even the purpose to call CPS if they think you are neglecting your baby or your child. So that really leaves it up to them, that if you're not willing to do a fourth spinal tap on a 21-day-old baby, that they're going to call CPS.
So their response was kind of ceremonial, like, we're going to look into this, but ultimately here are policies, and nothing's changing.
Nothing's changing, and to back up, we actually the citizens asked for their policy many, many times, and the response was, it's our policy not to give our policy. And I thought, well, then how can the citizens in Coeur d'Alene and the surrounding area know what they're signing up for when they go to Kootenai Health? That needs to be disclosed. So the fact that they have come out with the Q&A does actually put in writing what we're seeing that their policies are, and that's a problem, because they're ignoring the bulk of the statutes in Idaho that do give parental authority. They try to build layers of issues like the hepatitis B vaccine, or refusing a fourth attempt of a spinal tap.
Unbelievable.
Or like Max's daughter, who wasn't vaccinated. They wanted him to stay in the hospital for 3 days, wanted the child to stay in the hospital, even though the child was perfectly fine after she received some nutritional IVs.
Yeah.
So that's another way that they're increasing profits by threatening CPS. Well, look, my biggest fear is, and Kootenai Health has to think about the liability of this, my biggest fear is if a parent decides to go to a hospital further away that's in an emergency situation because they fear the ramification of CPS being called on them here. They should be working on building trust with the community rather than threatening the community. So that's really my biggest concern. I hope that Kootenai Health will reevaluate their policy, make some changes, honor parental authority, listen to the parents. I mean, that's really where this needs to go. I think it's fair to say that Kootenai Health is pointing to the neglect statute as the reason and the ability to do this. But what we'd really like Kootenai Health is to look at the spirit of all the other statutes that support parental authority. So they can't just stand on that one statute and say they get to decide what is best for a child. They are not the authority.
They're not the parent.
They're not the parent. Now, we have our natural rights given to us by God, and I know I'm preaching to the choir here, right? And the Constitution is there to support those rights. The Constitution doesn't give us our rights, it supports those rights.
Yes.
And then Idaho state law supports those rights as well. So I think they're missing the point. I think they're missing the point. Health Freedom Idaho, we used our platform to get the word out and to tell these stories, but this is the citizens taking charge of their community and telling their community hospital that this is not okay.
If it's happening here, if it's happening in North Idaho,
North
Idaho, think about that. We are in conservative country where this stuff doesn't happen, and if it's happening here, it can happen anywhere. I have 8 children. I'm a mother. So anytime a parent's right to make medical decisions is usurped by a government branch, or the medical establishment utilizing government to strip away a parent's rights to choose any type of medical, that's an overreach, and we have to stand up against that.
Yeah,
Separate pharma and state. We're out here trying to educate the public on what is happening, whether it be medical kidnapping or forced vaccinations, and we have to reach the public in some way, and that means thinking out of the box. And so standing on street corners, walking through crowds of people with signs, we have to reach people. I think anytime we step out to educate the public, it has to be done in love and with a gentle spirit. And so we come out to just notify people in any way we can, because as you know, we're censored on social media.
Yeah.
It's like when we make posts, we're only engaging our own echo chamber. So how do we reach new people? How do we spread this message of warning others? Well, we take it to the streets. And today is exactly how we do that. We have a website, informedchoicewa.org. I could use some donations to help keep our campaign going to notify people of the dangers and risks of vaccinations. So go to informedchoicewa.org. make a donation. In the Target, it'll say Target campaign, put Spokane, so money goes back here into Eastern Washington.
Right.
That we can utilize that to really make a difference. Well, see what we're doing out here and join us in any way that you can, because we each have gifts. And all of our gifts are needed in this battle to protect our family, the family units. And so we need you. And I could tell you today that I could have came up with 1,000 excuses of why I could not have come out here. I have 8 children, I have activities, I've got laundry, I've got dishes, I've got vacuuming, cleaning, you name it,
We're
I have
all
it.
behind on
I
so
need an
much.
oil change.
Yeah.
I think I'm several thousand miles past that. But here's the deal. 95% of activism and making change is showing up. So we need you. I need to be here. You need to be here. We have got to rise up together.
Well, whether it's Kootenai or any hospital anywhere, the decision lies with the parents. The kids belong to the parents, not to the state. And it's the parents' responsibility in bringing those kids into the world to make the decisions for them on what's good or bad for them. And if it's a bad decision, then it's a parent's responsibility, and they'll, reap those repercussions. But it is their decision, not anybody else's decision. Well, if a hospital or anybody refuse to let somebody leave, that's kidnapping.
Yes.
So all they need to do is call law enforcement and say, I'm being held against my will.
That warms my heart to hear that. I mean, praise God. The thing is, so you're saying if someone is being held against their will,
That's kidnapping.
that's kidnapping. As the sheriff, you have the jurisdiction to go in and free that person.
Correct. Over decades, we've been indoctrinated into slowly but slowly the state taking over. And these folks are pushing back against that, and I came to hear their stories and tell them that as sheriff, I will stand on their side of it's a parent decision, not nobody else's. I have 33 plus years active law enforcement, promoting up through the rank of captain in an agency 5 times the size of Kootenai County. I've led every aspect of a sheriff's department. I've managed $80 million budgets, hundreds of personnel. Parallel to that, I've also owned a business, a law enforcement training business. So for 20 plus years, I've also been training law enforcement, and I train internationally. I'm a constitutional sheriff. The Constitution is the law of the land. Anything outside the Constitution is not a law. An executive order is not a law. What a doctor says is not law. It's the Constitution, and the kids belong to the parents. I'm Rick Whitehead. I'm running for sheriff in Kootenai County, and I'll have your back, and I need your vote.